You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey Vet Rehabbers, welcome to the Veterinary Rehabilitation Podcast. I'm your host, Dr. Megan Kelly, and today Deirdre Chiaramonte from Assisi Animal Health joins me, and we chat in one of my Behind the Vet Rehab product podcasts. She chats to us about a new product of theirs called the Canine Calmer, as well as the mission of Assisi Animal Health and how they got into making animal products, and they've been going now for 6 years. It was so interesting chatting to her. Over to Deirdre. Hey Deirdre, thank you so much for joining me.
Hello, Megan. Thanks for having me.
Deirdre, tell us about how you got involved with Assisi Animal Health. So you've been a part of the company for a very long time, I believe.
Yes, since actually before it was started, I had recently left a large specialty hospital in New York City where I'd started and managed a very large rehabilitation service. And coincidentally, I had actually worked with the human loop medical device. And even though there wasn't that much information on its use in veterinary medicine, I noticed there was a difference in the patients that I started to use it on. And soon after that, I met with John Wilkerson about veterinary rehab and the prospect of adding the Assisi Loop to the veterinarian's armamentarium against pets in pain.
Okay, so you were actually the reason that they moved into animals.
Well, it was interesting. John sat on the parent company board, and they noticed that there were sales to veterinarians, even though there wasn't any PR or advertising, and it sort of started to take a life of its own.
And now, if you look at the company now, is the veterinary market the same as the human market? It must be probably one of the biggest line of products that Assisi Animal Health has.
Yeah, it definitely is, and very exciting. So human medicine, we don't even have enough time to discuss all that and what's going on with pain management and the opioid addiction issues. But what's fantastic about the veterinary market is we really have started to focus on pain and the fact that rehab is going to become standard of care following any type of surgery that pets have. So we are blessed to have different treatment options for different vexing problems in veterinary medicine, for which there isn't a great, one size fits all treatment.
And tell me, the company, how many years has it actually been going? So even looking at the human side.
The human side goes back quite a while, and it had many iterations as different companies with this particular device. Same manufacturer, though, since the beginning, and includes all of the veterinary manufacturing. Assisi is turning 6, so happy birthday to us. And yes, I was lucky enough to meet the few people that were involved. I think there were only 3 back then, 6 years ago.
And I see you've got a new product that's just come out, so called the Canine Calmer, which we're going to chat a little bit more in detail about later on in the podcast. Okay. But it's interesting that you're sort of branching out into sort of behavioral things too.
Well, it is, so one of our missions is to make an animal's journey through life as pain-free as possible. But even standing one tier back from that, behavior has become such an issue with our pets, and separation anxiety, a big reason why owners will relinquish pets. And that is another problem where it is so vexing, so complicated, without a good way to treat these animals, especially if you don't want to do any type of pharmacy,
Yeah, and so many of those pharmaceutical drugs, they just have a sedative effect on them, so they completely change their personality. So I've got a Jack Russell who has separation anxiety, and I've tried many different things, and so I am sure going to be ordering a Canine Calmer to try it on her. But being a vet, I'm obviously able to prescribe. pharmaceutical drugs, and they work in that she doesn't display the behavior, but then her personality has changed. And I recall in practice having clients say this to me, and now having my own dog and experiencing it, we don't want their personality to change.
Right.
So I've checked out some of the videos on the website of a few of the case studies, and I was really amazed to see, because there's some before and after. Obviously they've put a camera in the house so that you can see exactly what the dogs are doing before and then 1 month after having the treatments. So it's really interesting. And separation anxiety is a bit of a pain for the dog and for us. So, it's something that's not nice. It's horrible to see your pet fearful of noises, fearful of you leaving, and you always wonder what's happening when you're not there, how they're feeling.
Yeah, and being stationed in New York and certainly for a while Manhattan, what a huge incidence we have. We're living in 30-story buildings with 20 apartments on every floor, and anytime a dog barks, somebody complains. So it is hopefully the Calmer Canine is going to be a game changer. Just watching and going through all of those cases that were involved in the pilot, just amazing. Anybody could see the difference in those dogs. So it's really exciting.
And I'm just thinking about us vet rehabbers and for certain patients of ours. So, for example, a dog that's had a total hip replacement where we're having to try and keep them quite calm post-operatively. It's always tricky, especially if you've got a very lively dog. And those dogs not being able to do all the things that they normally do, they can get quite anxious. So I'm thinking that the Canine Calmer will be ideal for them, those very boisterous, lively young dogs, to try and get a little bit of calm in them so that we don't have any post-operative complications.
Yeah. Well, interestingly, veterinarians had noticed that using the Assisi targeted pulse electromagnetic field therapy devices, especially the lounges and the Clinica pads, that when the patients were resting on them, they noticed that there sort of was a calming effect and that there was less anxiety in their terminology. So this is a different signal than the Assisi Loop and all those products. This is actually targeted to the amygdala, which is responsible for anxiety. And so, some veterinarians are like, do I have to, buy both? Well, one is definitely the Calmer Canine is going to be superior for dealing with anxiety.
And for those of you that haven't seen what it looks like, it's basically got a harness, and then it's like a ring that goes around the head. It looks like they're a little angel. It's quite cute. Yeah. And yeah, so they're obviously different sizes. So interestingly, I've always found that cats have been very responsive to any type of magnetic therapy, and they seem to have a really calming effect. Is there any plans on creating a product like that, the Canine Calmer for cats? Obviously, the sizes now, you wouldn't be able to fit that on a cat. Maybe the small you would. But is it different for cats than it is for dogs?
Well, we don't know yet because we haven't done research, but veterinarians and clients are going to take that into their own hands and report back to us. We are discussing now which direction we're going to go. Are we going to target equines or felines? We're starting to really branch out in the equine market because it's such a fabulous product. But, again, being involved with feline medicine and the issues they have, and feline neurological syndrome, all the things that we can actually help with one of our products. There is definitely cat research on the horizon.
Now, Assisi Animal Health is very involved in a lot of research, aren't you? So like all your products, there's research behind it. Tell us a little bit about the research that you're currently doing and any up and coming things that you're looking at.
Sure. So that's one of the great things about working for this company is that they know that there has to be a substantial amount of good research behind. And we put several years into the development from just devising a study, pilot study, proof of concept, and then moving on to a randomized clinical trial. We've had 2 successful stories with postoperative intervertebral disc disease with grades 2 through 4 and 5. And we are in the middle of, a TPLO post-op study, because we know that's one of the biggest surgeries that, cruciate injuries across the world. We are also doing a Chiari malformation study. We're almost halfway through. And then lastly, we are just about to launch into a feline osteoarthritis study, which is going to be pretty exciting because we know just dealing with non-steroidals in cats, first of all, I would rather do anything than pill my cat every day. And even though, we know those issues, there are issues between cats and kidneys and non-steroidals. So being able to use this NPED, we call it non-pharmaceutical anti-inflammatory device. We're hoping in the feline OA study, we're going to follow kidney values and to show that might actually help any part of inflammatory kidney disease in cats.
It's really interesting, and I think especially needed for cats. Tell us a little bit about the team. So how many people are in the team, and are you all based in a similar place, or are they people that are all over the world or all over the United States?
Well, our team has grown to we're just over a dozen now, and we focus on the mission, as I said before, to make an animal's journey as pain-free as possible. We have, we are in 4 states really. And I think another one of our mantras is we like to do well by doing good. We are animal lovers, dog, cat, horse owners, veterinarians, members of the American Kennel Club, Canine Health Foundation. We have a veterinarian who has an MBA. So all these are really fantastic teammates to ride this journey along with.
And your founder, you mentioned him earlier. Is he still very involved in the animal side?
Very involved, yes. He retired from the human side, and the family actually thought he was going to retire, and instead he decided to jump into something that he didn't know that much about, because John likes puzzles and fixing things that may not seem to be broken, but any type of medicine, human or veterinary, could use a lot of help, especially now with the opioid crisis. And in one of our IVDD studies, our loop was shown to be opioid sparing. So it's another fantastic tool to use.
Has he got animals himself?
He does. He has, he has a grand puppy now. The family dog passed last year, and he's been very involved with his grand puppy now.
Okay. Just going back to the Canine Calmer, you said that obviously it wasn't exactly the same as the CC Loop. So how does it actually work, the technology? Is it sort of a different frequency, or how can you explain that a bit more clearer?
Yep, it is a different frequency, and actually our website there's a Calmer Canine website, but it is amazing, and certainly we like to borrow a lot from the human side, and some of this was actually figured out on the humans and then brought over to veterinary medicine, and it has actually been shown to light up areas of the amygdala, so that's pretty exciting.
So is there a human product that is equivalent to this one?
No, there is not.
So an anxiety little halo for us people that have.
It's very, very odd the way that human medicine, medical devices work. I don't find rhyme or reason why the loop on the human side is not, issued to everyone post-operatively. But a lot has to do with insurance, reimbursement, and who knows what else. So we were able to borrow some very keen information on the human side and really have it prosper for us on the veterinary side.
I saw in the pictures on the website that there's sort of an area with a little sort of screen there. Is there a battery that's in there? Is it the same as the Assisi Loop, where you can only use it a certain number of times and then the whole thing needs to be replaced? Or is it chargeable?
It is different. I have to take mine apart, and I'm actually going to use it on my own horse starting this week, because he certainly has his own anxiety issues.
Yeah. Okay. Deirdre, it's been wonderful chatting to you, and I just want to thank Assisi Animal Health for everything they do for the rehab community. You guys are very involved in educating vet rehabbers, veterinarians on everything that you're doing, all the wonderful stuff that you're doing. So thanks for all that you do for the community. We really appreciate it.
Yeah, I love working for the company. It's fantastic.
And thank you to you too for all the education that you give, all the lectures that you provide for us. We really appreciate it.
It's fun. I look forward to seeing you at the next rehab meeting.
Vet rehabbers, for more information on how to take your career to the next level, go to www.onlinepethealth.com. Please don't forget to subscribe to my podcast so you'll get notified. I'm here every single week talking to vet rehabbers from all over the world, learning, and I would love you to join me. Hope you have an awesome day further. Cheers for now.